This is Dr. Judson Brandeis from BrandeisMD and Pornhub Wellness. Now, most of us watch James Bond movies, but we don't assume that we can do wild stunts like James Bond. However, many people, especially young men, base their expectations for their own sexual performance on what they see in pornographic movies. They eventually learn that professional pornographic actors make these movies, and scenes often require multiple different takes. Besides, many of the stars use performance-enhancing medications to prolong erections. Our survival instinct rewards early ejaculation, so it takes practice to prolong ejaculation. During intercourse, the typical time from vaginal penetration to ejaculation ranges from 3 to 7 minutes for the average man. But 50% of men ejaculate within 2 minutes. Ejaculation within 1 minute of penetration is considered premature. Complicating matters is the finding that on average, it takes men 5 minutes to climax, but it takes women 17 minutes. So there's an incentive for men to delay ejaculation. The International Society for Sexual Medicine defines premature ejaculation as a form of male sexual dysfunction characterized by ejaculation within 1 minute of penetration. The inability to delay ejaculation with nearly all vaginal penetrations can result in distress, frustration, and the avoidance of sexual intimacy. Premature ejaculation affects sexual confidence, relationships, and the satisfaction of both partners. Now, no one knows what causes premature ejaculation, but the levels of these substances definitely contribute. Low serotonin. Depressed levels of the neurotransmitter serotonin contribute to premature ejaculation. High testosterone. High levels of testosterone are associated with premature ejaculation. And elevated thyroid levels. Studies show that 50 to 70% of men with a hyperactive thyroid have premature ejaculation. After men take medication to normalize their thyroid hormones, their rate of PE declines to 15%. So what can you do about premature ejaculation? Well, first, try these over-the-counter remedies. For many men, the intense friction of intercourse creates a rapid climax. A straightforward solution is to use a lubricant to reduce friction. I recommend a silicone-based lubricant like Uberlube, which can significantly cut down on friction. Less stimulation will give you more control. Condoms. A latex barrier between a man's penis will also blunt sensation and help men stay in control. Several companies also make condoms with numbing medications like lidocaine or benzocaine in the inner lining of the condom, which further decreases sensation. Masturbation. Self-stimulating to climax 1 to 2 hours before sex is a common suggestion to take the edge off the drive for ejaculation. And numbing creams. The principal ingredient in these creams or sprays is lidocaine, or a similar medication, which is a skin numbing agent. Decreasing the sensation of the penis makes it more difficult for a man to achieve orgasm. 5 to 10 minutes before penetration, a man sprays or rubs numbing cream on the underside of the head or frenulum of the penis. Now, it's important to wipe off the numbing cream before intercourse so that the numbing cream does not reduce sensation for your partner. It's not uncommon for a man to last 1 to 4 minutes longer or more when using a delay spray like Promescent, Stud 100, or KY Duration. And herbal therapy. St. John's Wort is a natural antidepressant that is recognized worldwide as a mood booster. The natural herb increases the amount of serotonin used by the brain. In addition to mood elevation, St. John's Wort improves premature ejaculation without the side effects of pharmaceutical antidepressants. The only supplement containing St. John's Wort made explicitly for premature ejaculation is called Prelong, and it's sold by Affirm Science at affirmscience.com. There are potential interactions between St. John's wort and medications metabolized by the liver, so check a site like drugs.com for possible conflicts. Nitric oxide has an inhibitory role in the ejaculation process. Nitric oxide booster supplements like Affirm have been investigated as a treatment for premature ejaculation. And caffeine. One study from the University of Texas at Houston found that men who drank 2 cups of coffee a day were less likely to suffer from premature ejaculation, although research on caffeine and premature ejaculation is a little early. Now you can combine these over-the-counter treatments with sensory therapy. The start and stop technique is somewhat like sexual teasing that involves stimulating the penis until there is an urge to ejaculate, and then stopping until the urge to ejaculate subsides, and then restarting. Masters and Johnson's squeeze technique involves squeezing the head or glands of the penis until the urge to ejaculate subsides. And tantric sex. The essence of tantric practice involves slowing down intimacy, coordinating your breathing with that of your partner, becoming exquisitely attuned to them, and then experiencing your sexuality together at a slower pace. This approach heightens pleasure and intimacy, adding a spiritual dimension to the experience. And if that doesn't work, self-guided sensory therapy, or pelvic floor training. This approach involves learning to identify and control the pelvic muscle's contraction in response to sexual arousal, sexual stimulus, increased penile pressure, and ejaculation. Or psychotherapy, alone or with medication, can help identify relationship and personal issues, leading to anxiety that may contribute to premature ejaculation. Men can combine psychotherapy with medical treatment. A study conducted in Spain involved 157 patients comparing treatment for premature ejaculation using medication or psychotherapy, or the two in combination. Initially, participants had time to ejaculation of less than 1 minute. Medication extended the time to ejaculation to about 3.5 minutes. In contrast, psychotherapy extended the time to about 7.5 minutes. Selective serotonin reuptake inhibitor antidepressants treat depression as well as premature ejaculation. SSRIs include fluoxetine, also known as Prozac, sertraline, also known as Zoloft, paroxetine, also known as Paxil, and citalopram, also known as Celexa. An 8-month study involving 480 men experiencing PE evaluated the effects of those 4 SSRI medications. The results and effects of these SSRI medications in terms of delay in climax was similar among the drugs, averaging 70 to 75 seconds. Side effects generally reported include possible decreased libido, fatigue, yawning, nausea, diarrhea. Men have to take SSRIs every day in order for them to work. Now there's a medication called Prilogy, also known as duloxetine, which is a fast-acting SSRI. Duloxetine is ideal for premature ejaculation due to its short half-life. If it's taken 1 to 2 hours before intercourse, Prilogy results in a 2 to 3-fold increase in control and satisfaction. Now the FDA did not approve Prilogy for undisclosed reasons, and it's only available outside of the United States. Viagra and other PDE5 inhibitors reduce performance anxiety, increase nitric oxide release, and lower levels of stress hormones, and dilate the smooth muscle located in the vas deferens and the seminal vesicles, thereby reducing stress hormones, and therefore they can theoretically reduce premature ejaculation. Congratulations on reading this and other articles in this series. It means that you take your sexual health seriously and seek advice from a reputable source. For more information, please visit BrandeisMD.com or AffirmScience.com. Stay tuned to Pornhub Wellness for additional articles, and please suggest further topics and send in your questions. In my 25 years, I've seen a lot, and if I don't know the answer to your question, I'll consult one of my colleagues. Your sexual health is important to me and to Pornhub. Thank you.